In this hospital outside New Delhi, patients' medical records are written on loose sheets of paper before being filed away in blue folders. The system is problematic for patients with long-term illnesses like cancer or diabetes, as records become difficult to maintain and trace. Development experts are now looking at how apps can help address these issues. Donald Zung from Trinity Logic in Australia has co-designed an app for diabetes management that replaces traditional paper systems. It also uses photo recognition to give detailed nutritional information about food items.
You take a photo and then it recognizes the food. So it does this by comparing against a whole list of photos we have on our foods database. So right now the database we're using is a large database of Australian foods, but we can, by simply changing the database, this application will work in India or like any other country.
The Asia Development Bank has now partnered with Microsoft to support software innovators like Donald Zung to create development-focused apps for Asia. Joel Bakiz used this platform to develop an app designed to link blood donors with people in need of blood transfusions in the Philippines. He was inspired by his own experience of needing blood after he contracted dengue fever.
I realized that there is a lack of blood supply when the doctor had to tell my relatives to look for blood.
The Philippines faces an annual blood shortage of around 400,000 units, meaning tens of thousands of patients do not receive blood when they need it. Many patients are forced to source blood through social networks like Facebook and text messaging. Bakiz's app works by targeting donors based on locality and blood type.
Basically, the applications to do a crowdsource through web and mobile application, crowdsource for blood. So the advantage is that it saves time as well as it saves money in the part of the patient.
In an app called Mappy, Jang Yong-hung from Korea has integrated GPS mapping technology with smartphone cameras. The user navigates by following arrows in the phone's camera view. They can plot their own journey or receive directions from other people.
My friend who received the information will take this smartphone 3D mode. We also provide the augmented reality, which means if we turn on his camera on the road, we can provide the road view with the directions.
Apps like Mappy could have a huge potential in regions with poor infrastructure. Whilst the technology for such apps is available, access is limited. Even the cheapest Android phones and tablets are out of reach to the 1.7 billion people living on less than $2 a day across Asia and the Pacific. Frank McCosker manages Microsoft's global strategic accounts. McCosker said Microsoft is exploring how shared access to phones and tablets could benefit these communities.
Access is key. If you don't have the technology, then the apps are relevant. So we look at shared access, we look at communal access, we look at government access, and then we also look at how we can enable it through the consumer ecosystem.
The worry is that people without access to these types of technology may fall behind. Some experts in Asia are now exploring ways to replace traditional school textbooks with tablets. Matt Fierce, India director of Dimagi, a social enterprise that makes software designed to improve healthcare in developing countries, said that whilst replacing textbooks with tablets might not be feasible just yet, it's still important to ensure that children have some access to this technology.
And whether it's having a couple laptops or a couple tablets for people to use just to become familiar with IT technology so that it becomes kind of something that they learn along the way in addition to other subjects they're learning. I see that as kind of a huge potential because IT becomes, or kind of interfacing with phones or tablets or computers becomes such a critical life skill nowadays.
Apps for Asia have been showcasing their top 15 apps at the Asia Development Bank's 46th annual meeting in Delhi. The hope is that leaders in health, education, infrastructure and governance will see the development potential in modernising existing systems with app-driven technology.